Possible contact with snake venom is fang marks, which might look like puncture wounds or lacerations. The fangs often penetrate only a few millimeters, but occasionally enter deeper tissue space or blood vessels. Within minutes of envenomation, stinging burning pain begins. The limb may swell to twice its normal size. Signs and symptoms of toxicity are almost always apparent within 8 to 12 hours of a snake bite. Symptoms for phospholipase A2 will develop skin irritation at the site of the bite, which can lead the person to have convulsions. Internally, phospholipase A2 from snake venom can cause hemorrhaging chronic pulmonary edema. Facial, lip, and tongue swelling may develop after envenomation to an extremity and may cause airway compromise. Patient may report unusual taste and increased or decreased salivation. Severe envenomations may result in hypotension and shock. Nausea, vomiting, and diarrhea may develop early in severe envenomation. Phospholipase A2 of snake venom is known to target the central nervous system and heart in mammals. A patient who has sustained a snake bite would initially be brought to the hospital. There, a series of blood tests would be performed. These labs would be repeated after each course of antivenom and every 4 to 6 hours after initial control has been established. Potassium, renal function, and creatinine kinase should be monitored. Antivenom would be required. Other recommended procedures and treatments include tetanus prophylaxis, local wound care, IV fluids, cardiac monitoring, anglasia, and to follow all laboratory values that would be coming in every 4 to 6 hours. If patients have severe swelling and compartment syndrome is a clinical concern, monitoring compartment pressures would be required. It is important to note that initial treatment will always start with antivenom. Fasciotomy, which is a surgical procedure where the fascia is cut to relieve tension or pressure, is commonly used to treat the resulting loss of circulation to an area of tissue or muscle.
Created using Powtoon.